Hi, my name is Agnieszka Sekula, and this is Dr. Prash. We are from Enosis Therapeutics, and we will speak to you about the use of virtual reality in psychedelic-assisted psychotherapy.
Psychedelic-assisted psychotherapy utilizes the unique properties of the psychedelic experience to evoke an altered state of consciousness in a guided manner, so as to engage in deep psycho-emotional processing for patients that are treated for a range of conditions, most notably end-of-life anxiety, treatment-resistant depression, and post-traumatic stress disorder. In fitting psychedelics into current established clinical models, the process of engaging with the psychedelic experience has changed substantially. Traditionally, the entire process of preparing for the experience, going through it, and then processing the lessons that emerge from it has taken place in the same environment, with the same people, and often utilizing other altered state practices for integration, including dance, meditation, and frequently group processes. In a clinical model, the process has been divided into three distinct phases, with the psychedelic experience often taking place in a comfortable room, accompanied by two guides or therapists, and supported through the use of music, whilst preparation and integration phases may take place in a different environment, with the therapy based predominantly on cognitively heavy talk therapy. One of the main drivers behind our approach has been to refocus psychedelic treatment on the emotional, embodied, experiential moments of the psychedelic experience.
We know that the depth of or the intensity of the mystical experience are correlated with the impact that the psychedelic session has on the client and on the therapeutic outcomes following the psychedelic psychotherapy. Research into combining different state altering practices suggests that the augmented cumulative effect produces a deeper altered state or a psychedelic experience. Moreover, this cumulative effect has been utilized in traditional settings, where the psychedelic substance is often accompanied by a form of shamanic practice or ritual, for example, drumming or dance. Recently, we have also discovered that virtual reality is capable of eliciting altered states and has been highly successful in facilitating other therapies that entail production of an altered state, for example, meditation. Based on that, we began to research and explore methods of applying VR and psychedelics together. One of our models, Anchoring VR, uses multisensory anchors of self expression to record insights that emerge during dosing, which can then be revisited during integration. Anchoring VR is used towards the end of the psychedelic experience in the psychedelic psychotherapy model to capture the insights that emerge from the experience while they unfold. This is meant to allow patients to start forming the first narrative in a way that is more emotional for a multisensory expression. Those expressions become anchors of their profound raw psychedelic insights, which can then be revisited during the process of integration. Once reapplied in integration, anchoring VR improves access, comfort, and ease of addressing key insights. This enhances the consolidation of memories. In essence, the immersive VR environment is used as a tool by the patient in the process of creating a personalized mind map. This mind map represents their psychedelic experience, as well as other insights, thoughts, emotions, or actions that emerge during integration, along with their respective links, connections, symbolic representations, or overarching themes. We see VR technology as a way of reconnecting with and once more prioritizing the immersive experience over the therapeutic framework. In this way, technology can bring us closer to the traditional models rather than further disconnecting from those traditional approaches.
Our approach is rooted in a few core beliefs. Firstly, that the sanctity of the psychedelic experience should be preserved unadulterated as far as possible, and that innovation should focus on the human elements of the therapeutic process, namely the psychotherapy. Two, that integration is the process by which sustainable psychobehavioral change is truly established, just as much as the psychedelic experience opens one's eyes to the possibility of that change. Thirdly, that experiences rather than conversation are likely to catalyze the greatest psycho-emotional impact. And finally, that a virtual reality based psychotherapy model has the capacity to take existing psychotherapy frameworks and present them as immersive, engaging, emotionally anchored experiences, and in so doing, greatly enhance the therapeutic impact. As both a company, Enosis, and as researchers, our main focus is the experience design of the therapeutic process, with virtual reality being the primary lever we're currently engaging to innovate in this space. We hope that our work with virtual reality helps inspire a more robust exploration of therapeutic approaches and provides an alternative lens through which to re examine mental health, human nature, and consciousness. We shouldn't be limited to the methods that we developed decades ago. And even if the therapeutic models we developed this decade don't end up using virtual reality, this process of engaging technology can allow for the exploration and development of new approaches. Thank you.